Welcome to another presentation, and this time we will focus on the immune system, but in relation to cancer, to malignancies. And we will give also one example of a study we did in our concept, Gorter model, and we compare that at the end of my presentation with a study which is comparable, done by Professor De Vleeshouwer at the University Leuven in Belgium. And we will compare what his results, his and his team results were, and what our results were, to see if there's any difference and maybe a better outcome in the concept we have developed over the last, I would say, 50 years. So we will talk here and talk about the function, the working, and possible efficacy in dendritic cells in the treatment of solid tumors. And my introduction will be first in general to talk about dendritic cells, what they do, their function, and how we can improve the function of dendritic cells and their numbers. And then give some examples. And we will finish with the study in glioblastoma multiforme stage 4. And that is one of the most aggressive tumors. That's a brain tumor, and essentially, also in the world literature, nobody survives that. Although currently, compared with 30 years ago, because of improved care and earlier diagnostics, the outcome has somewhat improved, but to the best of my knowledge, people, once they have glioblastoma multiforme stage 4, there is not really any, or was not really any effective therapy. So therefore, we'll start and we'll talk about the dendritic cells. And here you see a picture of, and that's also an important component of what we do with local hyperthermia. And local hyperthermia has been well developed and established specifically over the last, I would say, 25 years in Europe, but also in some parts of the United States, and even at the MD Anderson in Texas in the United States, studies have been done with the hyperthermia. And there are in principle two forms of hyperthermia, which we'll both discuss. I will start with the local hyperthermia. And here you see on the picture, you see a patient where you see the back of his head, and he's also completely bald. He was treated and radiated and received chemotherapy, so Temodal, for his end-stage glioblastoma multiforme, and there was maybe some delay, but then further progression in his brain tumor. So it is our tradition. We treat patients first of all with local hyperthermia, and here you see an example. Then you see that a patient, in this case, it's his head, the complete head, the whole brain. Could also be, see later, the liver or the lungs or any other part where there's a primary tumor or metastases, and we bring through the tumor or the metastases, we bring an electromagnetic field which goes straight through you, has no known biological effects. But when cancer cells or tumors are in this field, because there's more friction, they will, when you get friction, you get warmth production, and then very specifically in each cancer cell, the temperature in the cancer cell is increased. And after about 30 minutes, the temperature usually in a tumor cell has then reached 41, 42 degrees Celsius. But we'll see what kind of effect that has. So here is another patient Also, she had metastatic breast cancer. We treated her around 2005 to now 2006. She's also treated with local hypothermia. You see, she's very comfortable. She smiles. It takes an hour, and sometimes people fall asleep a little bit, and you actually don't notice anything. But any cancer cell, especially tumors and metastases, which are in this field, will quickly increase intracellularly, so inside of the cancer cell, to 41, 42 degrees. And that is, cancer cells have always an abnormal metabolism, and they tend to make more lactic acid. A normal cell, when it burns, when it metabolizes glucose, then at the end, the waste product is carbon dioxide, CO2, which we exhale. Cancer cells, they make much more lactic acid. And if a cancer cell is then pushed and to double or triple its metabolism because of its increased temperature, it makes so much lactic acid that the pH, or it becomes so acidic inside the cancer cell that the cancer cell goes into necrosis. It dies during the treatment because of its own lactic acid production. So there's further no side effect, no toxicities. And the only contraindication is when a patient has a pacemaker. So a pacemaker under certain circumstances can sort of get derailed if it is close to such an electromagnetic field. But otherwise, there's no contraindication. And what we do, so here you see this patient has then, here she has also here in the lungs and also in the liver, she had multiple breast cancer metastases, and we could all completely dissolve them in combination with the dendritic cells. And that is now for sure 12 years ago. She's doing fine. She gets her yearly or bi-yearly now checkups, and she has been, since the treatment in our centers, she has been completely free of breast cancer, and it looks like she will celebrate her 88th birthday. So, now, and then the other side here, that is the total body hypothermia. So now what we do, this is an example of a bed in our clinics where a patient lays in a kind of a tent with the head outside, so that you breathe in just normal room temperature, but with the help of infrared lamps, the temperature, the core body temperature is step by step increased. And usually we do not go higher than 38.5 to 39 degrees Celsius. So therefore this method is called fever range total body hypothermia. And why do we do this? We'll explain that in a moment. But here to go back, here see actually the first really scientist who discovered the value of fever was Professor Coley in the United States. And we see here a picture that's from an archive where you see students, very different in those days with sterility, but he shows, and he as a surgeon, he operates cancer patients, and then he noticed that often in that time, so 1870, 1880, 1890, there was no age yet of antibiotics. So when patients would get a wound infection, they would often, sometimes they could even die from that, but for sure they would get always several days a high fever. And he noticed that those patients who he hadn't really been able to help much as a surgeon, if they would get wound infection, and then the temperature would go up 5, 7, or 10 days to really 39 degrees, so high fever, that many of them did remarkably better afterwards. So although he couldn't really understand it as we do now, But he said, oh, well, when you have cancer, fever is good for you, so to speak. And then he developed then also a treatment which was up till the end of the Second World War, also in Europe and all of the United States, the most commonly used form of therapy to treat cancer. And again and again, also successfully through fever. Yeah. So, and now here, of course, our beds are very comfortable, and then a patient is put in such a bed. The whole treatment takes about 4 to 5 hours, and in about a 2-hour period with infrared, the body temperature is increased to 38.5 to 39 degrees Celsius, and then the lamps, the infrared lamps, are switched off, and then the patient gets the time, another 2 hours to cool down again. But then the effect is that the immune system is then very much activated. And that is one of the things also in evolution, also in the world, but especially also then in mammals, and humans are best equipped to regulate the core body temperature from the brainstem to react with any trauma, any threat, any infection right away with fever. And through fever, you can activate, or your body activates, it's a physiological attempt to overcome a threat by stimulating, by activating the immune system. Now here one other doctor our clinic who also that controls also the core body temperature and how the patient is doing, and during the treatment also there's an infusion, a drip, which is followed also with some vitamin C and other components to optimize then also the immune response towards increased body temperature. And here. So here you see also one of our nurses also with a patient, and so the patient is never left alone, but just accompanied. We have never ever seen any difficulties, and our oldest patients we treated with total body hyperthermia was 84, and she did very well and actually liked it also, the effects. Okay. Now, so first I want to talk about cancer cells, tumor cells, cancer cells. They have escape mechanisms. That means they can essentially make themselves less visible for the immune system. And we get to that in a minute. So when I talk to patients, I usually sort of say, well, if you're bad guys in the streets, in the shopping mall and so, they want to hide that they are bad. So, and what they do, they do it like this. Then they lift up the arm, so to speak, and they cover their face with the jacket. But it takes energy. And now if you put a cancer cell under stress and it starts to is forced to make more and more lactic acid, then it puts all its energy, it must put all its energy in surviving. So then instead of that the cancer cell walks around like this, it must do like this. And then it becomes better visible. So it drops its escape mechanisms. Now, of course, I talk in an image, but I think the image is true, that you understand when you put cancer cells under stress, just simple like increased temperature, then they drop their escape mechanisms, and then they are more visible for the immune system, especially for the dendritic cells. So therefore, we like to do that also to hamper, to make it for a cancer cell in a natural way more and more difficult, so that it will drop its escape mechanisms. So, and therefore I have listed here, but you can read it also later once more in the video itself, and some literature links, that fever is good for you. And unfortunately, even also I'm linked to 6 universities as faculty member, and unfortunately medical students and also young doctors get the message, fever is the cause of disease. But actually the opposite is almost always true, that your body is a physiological response to stress, also when you have trauma only, but also through infection and when you must fight more against cancer. That always comes from your immune system, and you can activate the immune system with an increased body temperature. And that is what I have here listed together, and how important that is, that not down to necessarily suppress fever. You keep always the back of your mind as a patient or as a healthcare provider or as a colleague, that by itself, as a fever is good for you. And we'll also show later on that when children, with any little increase in temperature, they quickly get especially Tylenol or paracetamol in Europe it's called, then you decondition, you teach the body and also the brainstem not to augment a fever anymore. And then you have much more at risk for chronic infections and therefore cancer. We'll talk about that. So here then also, there will be also a specific and separate presentation on the circadian rhythms and how important they are as an expression of a well-functioning immune system. Yeah? And now what you will see, we did that have done that many studies, also still at the Free University in Berlin, where we could show that patients with active cancer, they always had a lower body temperature, something more than a degree lower, which is core body temperature, so the temperature was measured rectally. But what is more important also is there was no rhythm anymore, because usually what you see here on the graph is that here what is red, that is normal in a healthy person who doesn't smoke. That's important to tell you. Then you see that in the morning, so by the time you wake up, so let's say 6 o'clock in the morning, your body temperature is at the lowest. And during the day, also when you don't do much, when you, sit on the couch and read the newspaper, at the end of the day, so around 5 o'clock, 6 o'clock in the afternoon, your core body temperature is at the highest. And then it slowly goes down again when you go to sleep. And during the sleep, it slowly goes back to the early morning temperature. And you can put in there like a sinus curve, practically sinus curve. And there's about a 0.8 degrees Celsius difference between early morning and late afternoon. If you have that, that means you're functioning very well with your immune system, and the interaction between your immune system and your nerve sense system and all the hormonal systems, which are especially regulated by the pineal gland and the pituitary gland. And then we have actually never found a cancer patient with a normal sinus curve, with a normal circadian rhythm, circadian with 24-hour rhythm. Now you see here on the bottom, this line, the black line, that is what we found in cancer patients with active cancer. Were not necessarily sick, but had active cancer. They had metastases. And then when we treated them, after about 8 to 12 weeks, we saw in almost all of them an improved, maybe not perfect, that's the green line, an improved circadian rhythm. And if all those patients who showed that early on in the therapy, we could already say now 99% certainty, those patients will respond well with just the natural therapies we do to improve immune system. Well, we'll talk about that more. Now, so it's important, circadian rhythm, but for that we will spend a much longer independent session on to explain and studies done with to show the importance of having a well-functioning circadian rhythm, and also if you're sick, also chronic ill, not necessarily with cancer, to improve ways, and we can do that, to to increase your core body temperature. You get warmer, so to speak, and have the circadian rhythm back. And you see that patients who did well, they all had, maybe not perfectly back, but had a significantly improved circadian rhythms. Now, what are dendritic cells? This is what I would like to say. A regular person, so an adult, 75 kilograms, 80 kilograms, who doesn't smoke, doesn't drink alcohol, does do nothing which God has forbidden, doesn't take antidepressants and so. A healthy person will, and you can measure that also in the blood and so, a healthy individual will make about 100,000 cancer cells per day. That's per 24 hours. Through mutations, through certain toxins maybe in your food because of colorings or so, or radiation you are exposed to. Currently, of course, also 4G and 5G radiation is much more and more also in the center of medical research, because there are questions, concerning questions, what the effects are when you're continuously exposed also to strong electromagnetic radiation. So therefore, again, an average adult person in the Western world will make roughly 100,000 cancer cells per day. Now, but still, I hope none of you will ever get cancer. But you know that in the Western world, about half of all citizens, half of all people living in our culture will get in their lifetime a cancer diagnosis. Yeah? 70 to 80% will die from the cancer. So cancer, after heart and blood vessels disease, cancer is the second leading cause of death especially in the Western world. Good. And therefore the immune system has two, let's say, legs on which it walks. On one side, it is the production of antibodies, and antibodies, they can neutralize, they can capture, they can stop viruses or bacteria in growing, and even also stopped in such a way that the virus is damaged, cannot further progress. And so on the other hand, we have the cellular immune system, and there I want to talk about the cellular immune system. These are immune cells, they're all white blood cells, and they have specific functions. And the dendritic cell is called, the Greek word dendros means branches. So, and if you look here is a picture of a dendritic cell, and you see here that is a cell with multiple of these branches, so to say. It reminds of the branches of a tree, and here you see also more, but it's from two different mammals of dendritic cells, and you see they have tens, sometimes hundreds of these branches, so tentacles. And I see here one last picture I'll show here, and you see here that here what is yellow, that the computer made it like yellow, that is a dendritic cell with multiple of these tentacles, almost like an octopus, and it moves through all the inner organs, and they check each cell they meet if the cell is normal or a mutation which is still okay, or could be precancerous, or if it's a cancer cell. And that's also amazing that each dendritic cell, knows exactly what is good, what is suspicious, and which cells should be killed. Yeah, and there's also one of those many miracles in nature that each cell in my body knows how a cell should be in the brain, or your prostate, or your liver, and if it's wrong, then it will give a signal. What does it do here? And that's really amazing, but we know more and more about it. Here with the dendritic cell, at the end of the tentacles, it has tiny little, let's say, openings, like little mouth, and it will sample, it will take biopsies of what is abnormal of that cancer cell. So we call that a tumor-specific antigen. It will take a sample of that, and possibly multiple samples, and then it will quickly move to the closest by lymph node. And a lymph node you can compare with a military base. And if you have so the dendritic cell, you could say that is a policeman. It can know what is good and what is bad, and will recognize bad guys, and then take a sample and then quickly go to the next lymph node. And there, if you're healthy, in your lymph node are hundreds and thousands of millions of well-trained Marines, well-trained soldiers, and they are waiting to be instructed what is the enemy. And now, we call them natural killer cells, NK cells. And now, one dendritic cell, one policeman, with many samples of what's typical of that cancer cell, which must be killed, is then presented to these Marines, to these killer cells. And this whole process of transformation, of transfer of the knowledge of the knowledge of the dendritic cells to the killer cell takes about 2 to 3 hours. And then, so to speak, the dendritic cell steps aside, and then somewhere between 3,000 and 5,000 killer cells, as a little army, they move out of the lymph node, out of the military base, and they also know usually the direction where to go, and that is still not well understood to the best of my knowledge. But then they find cancer cells with these specific markers, and then they kill that cancer cell. And then, and that's all well documented also in vivo microscopy and so on. That means in tissue following cells with a microscope, in the living tissue. So, and then usually after about 24 to 28 hours, after the dendritic cell has recognized a cancer cell, that cancer cell has been killed, has been destroyed. And there are other cells, granulocytes or other white blood cells, and they are like garbage men, and they eat the pieces of that cancer cell, they absorb them, and they delete them. So therefore, if you have a well-functioning immune system, then, and you make 100,000 cancer cells on the average per day, where you do have no sins, so to speak, you will not develop cancer because they are early enough recognized and then killed off. And therefore you can say, if you develop cancer now, then you have essentially one or two weaknesses in your immune system. One is that your dendritic cells, your policemen, cannot see well enough anymore, as if they need reading glasses, so to speak. Or the killer cells, the Marines in the military base, well, they are lazy, or they rather go home, or they drink beer or have a joint or so, but they do not want to really are ready and easy to go and kill. And that we could also document. So we could also document that patients with active cancer, they always have a significantly suppressed killer cell function. And we could also show, but that will be another presentation, that we could show that, for instance, with treating with the mistletoe, Viscum album, which is used in Central Europe since 1923, and we could show, and even some PhD students who could document that the mistletoe improves within 8 to 12 weeks the killer cell function to practically back to normal. So therefore you must always remember that in cancer, when in cancer patients, or when you have cancer yourself, there are multiple reasons, but in the immune system, it will always mean you don't have enough policemen, the dendritic cells, or they can't see well anymore, and killer cells, which are significantly suppressed in their immune function. So, now the dendritic cells, they were also in 2011, the dendritic cells there were 3 people who played a major role in discovering and understanding the role of dendritic cells. And for that here, they were here, that is this, these 3 are mentioned here, especially Ron Steinman is also well known because he died from a pancreatic cancer, but not usually within a year. What is the lifespan of somebody with pancreatic cancer? But almost 4 years, to the best of my knowledge, because he treated himself with dendritic cells. So he had 3 times for sure prolonged lifespan in a good quality of life. But the Nobel Prize was awarded in 2011, but around these people, these 3 who were the first to describe them, but there were groups of researchers, like in the University of Göttingen and the University of Vienna, and also our group. We further developed that also in how can I use it practically. And one of the major steps because dendritic cells were not really understood, or how could you make them? So what we do, that's what you will see then in the next, when we discuss this, here these are just the 3 Nobel Prize. They 3 shared the Nobel Prize for the discovery of dendritic cells, but then 3 main centers, research centers, then especially also in University of Göttingen, but also we collaborated strongly with them, and Vienna. We could develop how to make them, and I'll explain. It's very simple, essentially, to make dendritic cells from a patient's own blood. So, you will then see here that, already it's a little bit of summary, but without well-functioning cellular immune system, you can never be prepared, can never recognize, and then kill off cancer cells. And remember, you make them at least 100,000 cancer cells per day. Yeah. So, now, and then I want to tell you, I just choose one out of many, but of course we have very significant positive effects and complete cures in malignant melanoma or prostate cancer or almost any form of cancer. And 96% of all our patients came to us when they were actually hospice patients. They went through the regular route, and the different chemotherapies, the radiation, maybe surgery, and so on. And finally, they were told, well, there's not really much we can do, or maybe a phase 1 study. But so, and then usually this family members started searching and found them a treatment with dendritic cells. So, and now I want to show you and compare. There's a study done by Professor Vleeshouwer in Belgium, and that was done and finally published in 2004 in 12 patients with glioblastoma multiforme, stage 4. And they were, no, I don't want to spend too much time on it, but only compare what we did. So he had 12 patients, but what he did is that his, I wouldn't say dogma, but his point of view was that when you make dendritic cells, the patient's own monocytes or white blood cells from the blood, they must be primed or loaded. So you need specific tumor antigens, specific markers of a tumor, and expose those dendritic cells to these typical markers of a specific tumor, and then give it back to the patient with the idea that you could only activate, or you had to train dendritic cells outside of the body and then inject it back. We had practically maybe once a year an exception. From our patient who came to us, we had no tissue. It was only fresh tissue or deep frozen tissue can be used for priming or loading. So, but he did then on Professor Vleeshouwer did then a biopsy still of the what was left of the glioblastoma in the brain, which is not always without complications. To drill a hole in the skull and then take tissue, and but he did this, and then he vaccinated 3 to 6 times, and then so in the skin, yeah, okay, and then the results were that some patients really improved, and what is then the bottom line important, that 17%, let's say 20%, so 1 out of 5 of his patients lived 3 years instead of 18 months. So there was a doubling of the survival time. Yeah, but no of the patients came in complete remission. So after a little while, we'll show, then all the patients had died. And that was published in a leading medical journal. Yeah. Then what we did, we had patients coming to us with a brain tumor, but many of them were so sick that when we made an appointment a week later, they already couldn't come anymore because deterioration or already had died. So they were really much more progressed. And also being in an hospice patient. So what we did, I don't want to go in all the details, you can look it up. We also have published this, that we had a whole pool of 140 patients with brain tumors, but not all of them turned out to be glioblastoma multiforme stage 4. You also have other forms of brain tumors, which are always fatal, but not as fatal, also aggressive as the glioblastoma multiforme. Yeah? And they were all treated with us, and we also did serial MRI scans, but that was always done in the university or in the city where they came from. With one exception, it was done by different universities, clinics, and they sent us a copy and the results of the scans. And we could see, so therefore we have also a third party that objectively could describe an improvement or not, and or the complete remission. And what we also did is there is a tumor marker, there's an abnormal protein which is made by these glioblastoma cells, that's called S100. And we also followed that, and we could see that patients, about half of them did very, very well, and then also the S100 tumor marker over a period of 3 to 6 months also came from, let's say, 100 back to 10 or below 10, so which was then normal, from a very highly elevated tumor marker to within normal limits. So that is also, so we had a couple of, besides the patients did better clinically, we had a follow-up of several MRI scans and the tumor marker S100. Yeah, and so anyway, so what we do also with any treatment with dendritic cells, or breast cancer, or melanoma, or prostate, just name it, we take some blood out of the arm, usually like 6 to 8 tubes, and we isolate from these blood the monocytes. About 10 to 12% of all your white blood cells are monocytes in the bloodstream. And these monocytes still have like stem cell like quality. We isolate them and then we can turn them in a process of 7 days into very vital, active dendritic cells, policemen, and they are given back to the patient. Yeah, and it's the patient's own blood cells, so it's autologous. That means there's no risk. You always think you can always think of the AIDS epidemic, where I was very much active in research. That you can always, there's a risk when you get it from a donor, a blood product or blood or cells, then you could be exposed or infected with or a virus that is not known yet or whatever reason. So to get your own blood product is the safest way to be treated. And we have maybe, I think for sure, done 40,000 vaccines with patients' own dendritic cells made from their own monocytes, and we have never ever seen any negative reaction. Yeah. So, and then here, and so what we did, I give you the data. We had done 2 times as many patients as Professor Vleeshouwer in Belgium. We had no tumor tissue. So we treated them what we call naive dendritic cells. And yeah, and I prefer that, but there's a whole other reason. Maybe we can talk to that once another time. And then what we did, we combined it with some sessions with the local hypothermia, as I saw you a picture of that before. And our results was that 46% of these patients, they went in complete remission. So with multiple MRI scans and S100 and so on, and clinically, they went in complete remission. That means the glioblastoma completely disappeared. And of many of those, there are also video documentaries when they came to the clinic and then so, and even 10, 12 years later, and many of those patients who went to complete remission is now 16, 17 years ago and are still in complete remission and have no signs and symptoms of glioblastoma. So 46% is practically half. Yeah, and so, and the data, there will be at the end of this presentation also a link, and you can really read also the study, the publication, and the results, and more in detail how a scientific publication is done with a presentation of the patient's population and then the results and follow up. Yeah, so therefore it is important. And what we just did also, we looked at the S100 and also in all the patients. Some patients, they did not go in complete remission, but some of them lived 5 or 6 years longer before they finally died, but had many, many years of more or less normal quality of life and daily activities. But anybody who did well, especially those who did in complete remission, they always had a decline and an S100 level back to within normal limits. Yeah. And then there was no toxicity. Well, officially, when you do publication, you could say there was grade 1 toxicity because patients who received dendritic cells, they always have, or most of them have, after 2 to 4 hours thereafter, some flu-like symptoms. And flu-like symptoms are a sign that the immune system are being perked up. So the immune system also picks up this impulse of the dendritic cells, and therefore also the temperature goes up. So we said also to patients, if you get flu-like symptoms and maybe a little of the headache or so, be happy because it's don't do anything. Don't take a medication against the fever. It will always disappear after 6 hours. It will be gone again. But it is a sign that your immune system really picks this up, and your chances to have great benefit or complete remission increase significantly. We also did that in many cancers. We could show that is also the case. So although officially In studies, when you have some flu, an increase of your core body temperature, so to maybe 1 degree up, it is then considered a toxicity, but actually it's not a toxicity. It is a sign that your immune system and all what we did to help you to pick up the effects of dendritic cells is working. So we always would call a patient a couple of hours later at home or maybe in the hotel and say, or make a home visit and say, how are you doing? And they say, yeah, I have some fever. And they were happy that they had some flu-like symptoms and maybe said, well, I skipped my dessert for dinner or so. And then the next day they're fine. But then all I want to say that fever, that should be one of my messages. Although you must always look what is the reason of a fever, but in principle, fever is good for you. Yeah, and don't suppress fever if also the reason to have fever is understood, is known, especially if that is a sign that the immune system is perking up, is being activated in its function. So and therefore we once looked at, we compared this, and the most important thing is that the study which was done in Belgium, that was in only 12 patients. In our group we had 24 comparable patients. The patients in Belgium were only treated when there was also, after a biopsy, that fresh tissue was taken out of the brain, which is not completely without risk. But they had not really any survivors after 3 years. And we have 46% in the way we have done it, who went in complete remission. And practically all of them are still alive 12 to 16 years later. There was one patient who died, but was already in 78, if I remember, but from other reasons, cardiac reasons, but not because of a glioblastoma. So therefore I want to round this off and say, and summarize that you can treat very successfully, and even can do it better now than 10 years ago, by improving immune function. That means you must understand how the immune system functions, and about the dendritic cells and the killer cells and this and that. Also your nutrition is important, your circadian rhythms are important, and so your lifestyle is important, but also that you, that it can be, you have essentially two choices also in medicine. Do I help a patient to improve its natural defense mechanisms, or do I give something, or maybe to suppress? And what is typical I'm not against all the benefits also in modern medicine, but you could sort of say that in modern medicine, in let's say in mainstream medicine, well, we are also mainstream. When you do something which the Nobel Prize was awarded, and it's not something you do in the kitchen table. But that I could say that mainstream medicine always gives antidepressants, antibiotics, anti-this, anti-that, and anti-hypertensivum. So it's always that you get medication to suppress. And sometimes that's necessary, especially if something is acute. Sometimes you have first suppress something, but then that is not, let's say, a cure. The cure is when you help the patient and all, through the evolution, all the mechanisms which have been developed to sustain life. But we all know also at the end of each life also is death. But I rather die when I'm 108 and I had a successful life than when I'm young and die. So, but for sure, there's much more in our organisms and in also developed through evolution, through which we should more rely on it. And I think what we have developed, so Gorter model in the treatment of cancer, we can show that actually we can improve the natural functions of the immune system and other systems, and the interaction between the brain, hormonal system and the immune system. And if you know much about it, and you can therefore also support it and improve it, then you will always have therapies with no side effects, no toxicity, because you don't suppress, no, you support and improve. So this would be was one example about dendritic cells, and that you can really see them as an image as policemen, and they crawl through all your inner organs, from your brain, prostate, here and there, everywhere, looking for cancer cells. And cancer cells, they try to make themselves invisible, the escape mechanism. They do like this, and they walk around, and they are less visible, they hide. But you can push cancer cells, for instance, just by simple increasing the body temperature with 2 degrees, and then these cancer cells, or they already die because of the intracellular lactic acid production, or they drop their escape mechanisms, and then they become much more visible for dendritic cells and killer cells and so on. But that's too complex for some presentation here. So this was an introduction, and give hope to cancer patients, and say, well, there's much more which can be done, and you should also, and the doctors too, should rely more on also all what we have in us to deal with emergencies, whether it's trauma or if it's cancer or an infection. Thank you so much.